8 Strange Signs of Pancreatic Cancer. Hello everyone, and welcome to a vital conversation that could truly be a blessing for you or someone you love. Pancreatic cancer is one of the most aggressive and elusive cancers, with global cases rising by nearly 12% over the past decade, and annual deaths now exceeding 460,000. Its silent nature makes it notoriously hard to detect early, often slipping under the radar until it's advanced, when treatment options dwindle. But here's the hopeful truth. Emerging research reveals that subtle warning signs can appear 4 to 7 months before a formal diagnosis, offering a precious window for early action that could save lives. The pancreas, a small organ tucked deep in your abdomen, plays a massive role in regulating blood sugar and producing digestive enzymes. When a tumor grows, it can disrupt these critical functions without raising obvious alarms, making early detection a challenge. Yet your body often sends quiet signals, everyday symptoms that seem routine but could point to something serious. In this series, we've explored some of these clues, and today we'll dive into 8 strange signs of pancreatic cancer that are easy to dismiss but critical to recognize. By listening to your body and acting swiftly, you can improve the odds of catching this disease when it's most treatable, offering hope and a chance for better outcomes. Before we begin, let's connect. Have you or a loved one noticed any unusual symptoms lately? Share your story in the comments. We read everyone. Now, let's uncover these life-saving signs and empower you with awareness. 8 strange signs of pancreatic cancer. 8 strange signs of pancreatic cancer. 1. Left shoulder pain, a hidden nerve signal. First up is a surprising symptom, left shoulder pain. Beyond the more familiar abdominal or mid-back discomfort, tumors in the pancreatic tail can trigger a unique pain pattern that often goes unnoticed. These growths may press on or irritate key nerve pathways, like the phrenic nerve or visceral nerve branches, causing pain to radiate to the left shoulder or create a vague, hard-to-pinpoint ache in the left chest. This pain is typically deep, dull, and persistent, unaffected by rest or changing positions, and may worsen after eating or lying flat, sometimes accompanied by a heavy, pressure-like sensation in the upper left abdomen. The challenge is how easily this is mistaken for something else. Cardiac. A 2021 study in the World Journal of Gastroenterology found that nearly 40% of people with advanced pancreatic cancer experience prolonged nausea or vomiting, often with 8 to 10% weight loss over 3 to 6 months. This is easily mistaken for gastritis, reflux, or indigestion. Take Linda, 58, who thought her nausea was from a new diet. When it persisted with weight loss and fatigue, a CT scan revealed a pancreatic issue, caught just in time. If nausea after small meals comes with weight loss, fatigue, or fading appetite, don't wait. Seek imaging like ultrasound or MRI. Early action opens the door to effective treatments, offering a lifeline. 4. Rapid unexplained weight loss, a metabolic alarm. Number 4 is rapid unexplained weight loss, a red flag that demands urgent attention. While weight can fluctuate, losing pounds quickly without changes in diet or exercise signals trouble. Pancreatic cancer drives this through metabolic shifts. Cancer cells consume massive energy, raiding fat and muscle reserves, while impaired enzyme production hampers nutrient absorption, leading to malnutrition. The result is a gaunt appearance, with muscle wasting and thinning fat layers over just 3 to 6 months. Research in the Journal of Cachexia, Sarcopenia, and Muscle shows over 80% of pancreatic cancer patients lose significant weight, many shedding over 10% of their body weight. This weakens immunity, reduces therapy tolerance, and slows recovery. For example, James, 60, lost 15 pounds unexpectedly and felt fatigued. His doctor's tests caught a pancreatic tumor early, improving his treatment options. When paired with fatigue, loss of appetite, or digestive changes, this symptom requires immediate evaluation. Acting fast can mean catching the disease when it's most treatable, turning awareness into action. 5. Sudden blood sugar imbalance, new-onset diabetes, a glucose warning. At number 5, we have sudden blood sugar imbalances, often presenting as new-onset diabetes in people over 50, with no typical risk factors like obesity or family history. The pancreas regulates glucose with insulin, but a tumor can impair insulin-producing beta cells, causing high blood sugar, excessive thirst, frequent urination, weight loss, and fatigue. Less commonly, low blood sugar episodes bring hunger, trembling, sweating, or dizziness. Lancet Oncology reports that about 1 in 4 pancreatic cancer patients are diagnosed with diabetes within 6 months before their cancer detection. For instance, Maria, 55, was shocked by a diabetes diagnosis despite a healthy lifestyle. Further tests revealed a pancreatic tumor, caught early enough for intervention. This sign is a critical clue. Unexplained glucose swings demand comprehensive evaluation, especially in older adults. Recognizing this can lead to earlier diagnosis, expanding treatment options, and offering hope. 6. Swollen lymph nodes, a distant signal. Number 6 is swollen lymph nodes, particularly in the neck or above the collarbone, like the left-sided Virchow's node. Pancreatic cancer cells can spread through the lymphatic system, causing firm, painless nodes that grow over time. These are often dismissed as minor inflammation, but their persistence, especially with weight loss, fatigue, or digestive changes, signals a more advanced stage. Consider Tom, 63, who noticed a lump above his collarbone. Initially thinking it was a harmless swelling, he sought help when it grew and he lost weight. Tests confirmed pancreatic cancer, and early action extended his treatment options. If you notice a persistent, firm lump, don't delay. Prompt evaluation can catch the disease before it spreads further, preserving hope for effective care. 7. Pain or heavy sensation. Under the right rib cage, a bile duct clue. At number 7, we have pain or a heavy sensation under the right rib cage, often caused by a tumor blocking the bile duct, leading to liver enlargement. This creates a faint ache or a pressing weight that may radiate to the back or right shoulder, worsening after fatty meals or lying on the right side. It's easily mistaken for a muscle strain or